Yes.
Yes, it's
Yay!
there.
Thank you. Thank you. So we are going to be kicking off a 4-part series. We're doing this because we're getting a lot of new agents, even new to selling Medicare. So Charlie and I have created these trainings so that y'all can it's going to go over every aspect of Medicare sales in a fun, challenging way. So stay tuned. We hope you make it to all 4. We'll definitely be having more people attend as these go forward, but this is just going to start at the basics and we're going to build all the way up to even social media marketing. So I hope you all enjoy this because we put a ton of work into it. So this series is called New to Medicare Agent Training, Client Assessment, and Needs Analysis. How many of you, and feel free to talk, I love it when it's interactive, how many of you will know how to do a needs assessment or a client assessment? Are you all familiar with that at all? Crickets. Okay, let's go on. Agenda. So today we're going to learn how to identify needs and priorities, lifestyle and medical history, probing questions, ensuring clients are matched with the right plan. This is a needs analysis. If everybody would put in the chat, if you need a copy of this, I would like to get this sent out to you, Charlie, or I will. But a needs assessment is key, especially when you're first starting out, because you're going to find out all the questions that you need to know. Signing up for Medicare, do they have employer coverage? What are their travel preferences? Can anybody tell me why we would be asking their travel preferences?
Well, not all plans cover outside of the U.S.
Correct. We're seeing now, it used to be Plan F and everybody wanted to keep their Plan F. And thank you, Charlie, for participating. Plan F used to be the one that had abroad coverage during travel. You'll notice that in the past 2 years, and now that you all are coming in, in recent years, a lot of the Medicare Advantage plans have put about a $50,000 benefit on Medicare Advantage for traveling abroad for coverage in case something happens, like somebody breaks a hand or ends up in the hospital. We know that the Medicare rules are going to move and get people to the border and across to America as quick as they can. But in the event that something happens, you're just better protected. And so Medicare Advantage and even Plan N, Plan G, I mean, you can buy more if you want, but a lot of these have those included already. The other thing we like to know is current health coverage. Is it employer? Is it MedSup? Is it Medicare Advantage? Not sure. The one thing you're going to find out when you're talking to these beneficiaries, they're going to say straight off the bat, I need a supplement plan. And whenever we get into these conversations, and this helps guide that conversation, you're going to soon learn that they don't know what a supplement plan is. And that's your key to educate on the differences between a MedSup and Medicare Advantage, because a lot of people just think it's called Medicare Supplement, either way that they go. We also want to know their healthcare providers. Generally speaking, we know their healthcare providers, or at least who send them to us, but people have doctors in different health systems. It's very rare that you find somebody that uses one complete health system. For me, example, I use SSM, I use Mercy, that's it. That's all I use. But it's all over the place, right? And so it's very important that we know that, because being in the provider program has afforded you the ability to work with our healthcare providers. And so our focus isn't, oh, I want to sell a ton of this plan so that I can make a bonus or get elite level status, but it's so that we focus on their continuity of care. We want to ensure that every doctor that they see is going to be covered on, especially if it's a Medicare Advantage. Charlie, why is it not important to know the doctors if it's a MedSup?
Because any doctor that accepts Medicare should accept your MedSup.
So So if United Healthcare is having a termination at one of our hospitals and somebody presents to the hospital with United Healthcare Med Sup plan, are they still going to be seen even though United Healthcare is being terminated? The answer is yes.
Yeah.
Because
There's
they
no
coordinate.
network in a supplement.
Correct. So whenever we talk about terminations and plans no longer being available in a certain hospital system or a doctor's, that is specific to Medicare Advantage. We also want to know their prescriptions because whenever we're looking and we are quoting insurance, not all drugs are covered by all companies. So, whether it's Medicare Advantage or a Part D standalone prescription drug plan, formularies vary plan to plan to plan. And if you notice when you're in Sunfire, if you look at the Part D prescription drug plans, you're going to see that they cost anywhere from $0 to $100. And a lot of that's going to have to do with their formularies and what type of prescriptions they cover. There are very expensive medications that not all carriers cover. And also, the biggest thing that Charlie and I have learned years ago is on the insulins, some plans will cover Nuvolog and some plans will cover Humalog. So we can also help you with that if you ever have questions, but it is very important that you get that list of prescriptions. Hey Charlie, how does a beneficiary on a PDP or Medicare Advantage plan save money on prescription drugs on their copays?
Save money on their copays or spread them out?
Save money. Whenever you get a 90-day supply, if it's for like your blood pressure medicine, your maintenance medications, on these plans, on a Medicare Advantage, on a PDP, it's essentially buy 2 months, get one free if they do a 90-day supply. Some stores do require, or some plans do require that you use mail order. And then there are plans that you can use Walmart, CVS, Walgreens, whichever their preferred pharmacies are. But since you brought up spreading it out, do you want to touch on that real quick or do we want to pick that up later, Charlie?
We can do it. Go ahead and talk about it now. I actually just had a client in the office that had brought me some paperwork from her carrier. We just got her switched for an April 1st effective date. She got some paperwork in the mail and she had no clue what to do with it. It turned out that it was information about the Medicare prescription payment plan. In her case, she didn't need to use it because her payments, her copays are only $11 a month. But in the event that she had a large deductible or that her costs were high on her drugs, it would have been a good idea to fill that out and send it in because essentially what it does is it allows your carrier, they will pay the amount for your drugs each month and then they will turn around and they will spread them out evenly over the remaining part of the year and you would make payments to them rather than having a front-loaded policy with that deductible. Then you can have a very even payment throughout the year.
Well said. And we will dive into that. But if anybody has questions, feel free to unmute and ask Charlie. So, okay. Moving forward. The importance of a Medicare needs analysis, provider network. We touched on that. We have to identify their preferred doctors and confirm that they are included in the network for the suggested plan. This step is crucial for maximizing healthcare benefits and maintaining continuity care. Everything we do with our client hospitals and doctors is continuity of care. And I will repeat that until I'm blue in the face. Use of prescription medications. Review the current medication cost share amounts and formularies to ensure chosen plan adequately covers them. And then financial considerations. Addressing budget constraints and cost sharing preferences is essential to create a plan that effectively aligns with the client's financial situation. What do you think we're talking about when we're talking about addressing constraints? I would like either Lisa, Alex, or Jeff to kind of chime in if you feel brave enough. Okay. Well, the financial considerations are going to be on premium, maximum out of pocket. We really look at financial considerations because, as everybody can see, especially after this annual enrollment period for those who are in it, it was a little crazy. It was a little nutty. Some of the carriers would stop commissions and enrollment into PPO offerings through Medicare Advantage. And that's because they're trying to maintain utilization management. Um, but when it comes to the beneficiary, the other financial consideration is a med sup. Most hospital systems, most doctors, they love Medicare supplements. The two strikes against an agent whenever we're talking about Medicare supplements, actually, there's more than that. But the first one I want to talk about is the obvious. You make more commission with a Medicare Advantage plan than you do a Medicare supplement. So naturally, everybody tends to lean into, and it's easier to sell when it's a $0 premium or low premium. So everybody kind of pulls towards Medicare Advantage. It's important that we stay in the middle and we let the client make their decision, because whenever we look at Medicare supplements, there are a variety of offerings. You have high deductible plan G, you have plan N. There are ways to contain cost, but we also have to be aware, and this is the biggest fight I have when I'm talking to our physicians, is there are a lot of Medicare beneficiaries who have had a Medicare supplement who can no longer afford them, plus the Part B premium, plus Part D, and all the things. And the other side of that is that there are people who would prefer to spend money when they need to use the plan versus paying for a plan in case they need to use it. And anytime I'm sitting down with somebody who's aging in or becoming ready for Medicare, I love to sit down and explain it to them in those details, that basically the biggest difference you're going to have, just in general, not going into big details, is that on a Medicare supplement, you're going to have a premium, but you're not going to have to pay to use it, with the exception on some plans, you'll have a Part B premium. On a Medicare Advantage, and this is generalized because we're not honing in on the letters of the Medicare supplement, and we're also not talking about every Medicare Advantage plan. And then I love to flip it and say, while we're going through this, I want you to be thinking, do you want to pay in case you need to use the insurance, or would you rather save that money and use it towards copays, towards your maximum out of pocket? And that's what we need to think about when we're talking about these financial considerations for the beneficiary. For us, we make less on a Medicare supplement, but there's far less balance billing, far less headaches when it comes to getting approvals and things like that. I'm not saying that Medicare supplements do not have to approve certain things, because they do, but it's less. So you are making less money, but you're also investing less time. The other problem with Medicare supplements are those who are over 65. If somebody does not sign up for a Medicare supplement when they are 65 years old or becoming eligible for Medicare, retirement, what have you, they get a guaranteed issue right into the Medicare supplement. Now, if they decide to go Medicare Advantage and they've been on it for a few years and then they decide they want to go to a Medicare supplement, there will be underwriting. Charlie, do you have anything to add to that?
I do not.
Perfect. You have to know your client's needs. Personalized recommendations. By gathering key details about a client's health, coverage, and medical needs, agents can tailor plan recommendations to fit the client's specific situation instead of offering a generic option or too many options. That's what I see more, is that everybody's like, oh, well, here's all the options, pick which one you want. The reason they ask about the client's health, because as we go through this, you're going to learn that we're not really allowed to ask health questions unless it's a part of the application process. Whenever we talk about the client's health, we need to know generalized things. One, if they are a cancer patient, they're probably going to do far better, depending on the premium on a supplement, versus paying 20% until they reach their maximum out of pocket of the chemotherapy drugs. The other reason we want to know their health is because if they have diabetes or if they have a chronic heart condition, they would qualify for a chronic special needs plan. They have far more benefits available to the beneficiary, and it just works out fabulously for those subset of beneficiaries. Medical needs agents improve client satisfaction. Grasping a client's needs and delivering a tailored plan not only elevates client satisfaction, but also fosters lasting loyalty. Whenever you tailor their plan offerings, they also see you as the expert. They know you know what you're doing because you've minimized it to these 2 or 3 plans, and you're able to say why, which one you feel would be a good fit for them. Reduce confusion. Medicare, it's not can be complex, it is complex. I've been in this industry for so long that I forget about the complexities. But you take somebody who has been working and has been on their group coverage and they're paying who knows how much for it each month. And then they come and learn, oh, I need part A, I need part B. What's part C? What's part D? What's a Medicare supplement? It is extremely confusing for them. But a needs analysis helps clients identify best plans for their needs, reducing confusion and potential issues. Any questions so far? So, cherry picking, it's illegal. I'm going to say that. Cherry picking is illegal. Cherry picking refers to agents choosing clients for their benefit, often selecting those with simpler needs to minimize administrative work while avoiding complex cases. They avoid sales activities where health screenings are being provided. Why do we have to avoid sales activities where health screening is being provided? It's against CMS rules. Whenever you take AHIP, it tells you that you cannot be there. And the reason is because they attribute that to cherry picking. If you see that somebody is super healthy, you might approach them because you think, oh, they'll be approved for a Medicare supplement. Or if they have high blood pressure and you find out that they have all these conditions, then you're cherry picking to put them in a C-SNP. So you can't be around if they're doing health screenings. If you want to sign up to do an event, which we'll dive into when we talk about community events later on in this series, you have to make sure that they are not doing health screenings at the event that you're signing up for. Compliance and regulations. Medicare rules strictly govern how agents can collect and use health information. Any questions so far? This is the quietest group ever. Okay. Charlie, can you still hear me?
We can.
All right. Just making sure, guys. Health questions on Medicare Advantage plans. Medicare agents can inquire about potential clients' health, but must avoid overly personal questions and obtain explicit permission before discussing health information. We should only ask essential questions to assess health needs for coverage and care management, avoiding sensitive personal details. You will notice that now that we're out of the annual enrollment period, even the carriers no longer have the question about sexual orientation and gender preferences. It's not that there's anything wrong with that. It's just that would be a personal question that we really probably shouldn't be asking. It is important to respect privacy while gathering information to determine eligibility for specific plans, features, or services. That is definitely geared towards your special needs plans, whether it's chronic, again, heart, diabetes, or if it's for duals who have Medicare and Medicaid. Next, we're going to talk about purpose-driven questions, avoid asking unnecessary question, what HIPAA is, and what are HRAs. So purpose-driven questions. Top insurance producers understand that focusing on serving and protecting their clients is key to business growth rather than just making sales. Brokers who invest time in understanding their clients' needs and values gain a competitive advantage over those who only push products. The other reason that we know focusing on serving and protecting our clients is key, because what is the number one rule in sales? Retention. Not only is it good to identify why or what plan they need, but it's also good because the more business you keep in your book, the more beneficiaries that you retain, the more money you start out with on January 1st in ramping up your year. So that could be a huge difference if you have people who leave because they don't feel like they were taken well care of. And that's not always the reason why, but we want to make sure we're doing everything that we can do at the end of the day to ensure that we have done what we can to retain our clients in our book of business, because that's the key to growth. So purpose-driven questions. These are some examples. General health status questions. What are your current major conditions? We want to know this because, again, that could answer a lot of questions. Are they 65 and going through a lot of doctor's appointments? Is the premium less than the maximum out of pocket? We want to know these major health conditions because it's going to qualify them for a C-SNP, or it's going to let us know if they would be better off in a Medicare supplement with a premium, even with a premium. Do you have any chronic illnesses like diabetes, heart disease, high blood pressure, arthritis, or cancer? There are chronic special needs plans for all of those people. In the majority of the markets that we work, again, it's going to be heart disease or it's going to be diabetes. Are you managing any ongoing medical issues requiring regular treatment? We need to know that so that we can let the new carrier know that they need continuing treatments, and that way they're covered. We can get them authorized before it begins, and it just significantly decreases the headaches that you may deal with down the road getting things authorized. Because if they have a surgery coming up, and if their previous Medicare Advantage plan or commercial plan approved it, it's going to have to be approved again through the new carrier. And you can use a transition to care form that's on each carrier's website and let them know what the beneficiary is facing so that it can be approved. Or oxygen, that's a big one too. Have you recently experienced any significant health changes? Care needs and utilization. How often do you typically visit your doctor for routine checkups? That's on the first page of Sunfire. When Charlie gives you a training through our tools and resources, you'll see that. They do that so that they can determine, are they a high utilizer or a low utilizer? And that also helps us look at the maximum out of pockets and also decide if HMO or PPO would be better for them. How do you use your urgent care or emergency room services? I love asking this question because oftentimes there are people who get on Medicare and maybe they didn't have insurance through an employer, and where they did seek their care was the ER. That really increases utilization. We come from a carrier, so we know what that looks like on the back end, and you want to know that so you can look at the copay for their perspective, but that gives you an opportunity to really let them know, hey, this is the copay for that. But if you went to the primary care doctor instead of urgent care for $50, it would be $0. Or if you went to urgent care for $50 instead of paying XYZ for emergency room. Even though the copays are pretty contained in Medicare Advantage and definitely contained in a Medicare supplement, it still increases premiums, and it also ruins utilization management for the carrier. Just FYI, you don't need to remember that, but useful information. Cost and coverage concerns. What is your main concern regarding the cost of your Medicare prescription drug coverage? Do you have any concerns regarding out-of-pocket expenses for particular medications or services? How important is having a low monthly premium to you? Do you understand the difference between Medicare Advantage plans and Medicare Supplement? Even after you explain it, they're still going to think a Medicare Advantage plan is a Medicare supplement. I had that happen yesterday. And I can tell you, I set it upside down, inside out, right to the left, left to the right. It just, yeah, sometimes they just don't get it. Theory questions. These are do not ask questions. Financial questions. Do not ask. If you are a financial advisor and you are speaking with the beneficiary during the meeting about their Medicare benefits, meaning their prescription and health, do not bring up any type of questions regarding annuities, life products, any of that. It has to be medical only. So don't ask financial questions unless you're trying to determine if they should apply for LIS or for Medicaid. So what is your social security number? They do ask for social security numbers on MedSup apps. They do, and it is required. You can't even push it through if you put all zeros. It is required. How much is in your savings account? That we have no need to know that. If you are a financial advisor, after you get them set up with their medical insurance through whether it's a supplement or Medicare Advantage, you can then let them know that you do that. And if they ever have questions, they can reach out to you or however you do financial services. What is your current net worth? Again, none of our business. Do you have any outstanding debts? Definitely none of our business. Questions about mental health. Do you have a history of mental illness in your family? Do you think you're going crazy? What is your diagnosis? Are you afraid to be alone? Those are questions that are on the CMS website, as you cannot ask those questions. If it's brought up, which sometimes it is, because you do get people who have diagnoses, and it is important to talk about when we're talking about a psychiatrist, psychologist, or any type of medications that they may need. But as far as just generally sitting there at a table with them, don't ask those questions unless it pertains to you helping them find what's best for them. Never ask or say, so free premiums, guys, even though there are a ton of Medicare Advantage plans with a $0 premium, we cannot say that they are free. We also cannot say that it's free to go to your primary care doctor. It's free to get labs. It's free to get an x-ray. You can't use the word free. I always substitute the word free for $0. That's just how I say it. You also can never say that I am a Medicare agent. You can say that I'm licensed to sell Medicare plans, and I work for MedicareCompareUSA, or I work for Hospital XYZ in their helpline, but you can never say I am a Medicare agent. Also, can I have a list of friends and relatives so I can call and offer them the same help? Charlie, that's a great line. Why can't I say that? I'm asking for a referral, but why can I not say that?
Well, first of all, you can't make the first contact. So getting that list of friends and relatives is going to do you no good because we're not allowed to reach out to them. They must make the first contact.
Exactly. So what's a better thing to do?
Here's some of my cards. Pass them along to anybody you think I might be able to help, or here's my phone number. Here's my email address. Be sure to pass it along to your friends.
That's my favorite one. That's kind of a trick that I've used. Is I love to make sure while I'm there that they put my name and number in their phone, so that if they have any issues throughout the year, or if they come up with any more questions, please feel free to reach out to me, but don't keep me a secret. Feel free to pass my number along to anybody who may be in the market for insurance in Medicare. HIPAA, Health Insurance Portability Accountability Act of 1996. I'm pretty sure we are all familiar with HIPAA because we get to fill out these forms every time we go to the doctor. Establishes federal standards to protect sensitive health information from being disclosed without the patient's consent. The U.S. Department of Health and Human Services issued the HIPAA privacy rule to implement HIPAA requirements. The HHS Office for Civil Rights enforces HIPAA. It's a federal agency. These rules apply to health plans and anyone who transmits health information electronically. So, Alex, who contributes health information electronically? You're on mute. Okay, maybe he's not there or I didn't fix it. Charlie, who transmits health information electronically?
Well, Alex put in the chat, he does.
Yes, Alex, you can speak to us. He does. He does. So do you. So does everybody.
Well,
because when we're in Sunfire and we're writing an app, we're submitting health information electronically.
Sorry, Taryn, I couldn't find the unmute button, so I apologize.
You're fine. You don't need to apologize to me. Sorry, that was a little rough. Alex and I have been friends for like 40 years, so I apologize. How HIPAA protects. What does HIPAA do? It reduces healthcare fraud and abuse, sets national standards for healthcare information, protects the confidentiality and security of health information. How does HIPAA protect health information? It requires health plans, healthcare providers, and clearinghouses to protect protected health information. It limits when and how protected health information is disclosed, and it gives the patient the right to obtain copies of their health records. That's HIPAA. By a raise of hands, how many people love HRAs? Me too, Charlie. Me too. HRAs are stands for health risk assessment. And Medicare sales agents ask questions from a survey to evaluate the current health of Medicare beneficiaries, identifying potential risks such as lifestyle habits, chronic conditions, and other health concerns. The reason they have HRAs is so that whenever they're new to a carrier, they can, the carrier can see imagine a Foursquare. Did everybody play Foursquare when they were little? The big box with the 4 little squares, you bounce the ball into each box. Well, there is a mechanism that carriers use. All health insurance carriers use this. And you have box A, B, C, and D, just because we're verbally talking about this. If you're in box A, you're healthy. When you're in box B, maybe you're on a blood pressure medication, an antidepressant, very minimal things. When you're in C, they're going to start reaching out to you and making sure you have everything you need. Those are the people who are in and out of ERs, hospitals, or may have had some testing done for a diagnosis. Charlie, is there somebody in the waiting room? Oh, or is that your hand up? Oh, it's your hand up. Okay.
That was my hand up from earlier. Sorry.
It's okay. So they do that so they know which category to put them in. Are they somebody who is going to need a lot of attention, a little bit of attention, and what type of resources that may not be in evidence of coverage that they can extend to the beneficiary or the member in this situation? This enables healthcare providers to also customize treatment plans and preventative strategies based on individuals' needs, which is periodically mandatory for all beneficiaries in Medicare Advantage plans. Charlie, you raise your hand. Why do you like HRAs?
I love them. Number one, they pay us.
Yeah.
You get a little extra cash in your pocket for filling them out. So with most carriers.
Yes, anywhere from 50 to 150 is what I've been seeing, in addition to your commissions. So yes, we love to ask those HRAs. I don't care if it's $20 more. I'll do it. It's going to help the beneficiary, and I get a little money. I like money. Oh boy, she forgot to do that. Okay, key points. Purpose: to identify potential health risks by asking health questions about medical history, lifestyle choices, diet, exercise, family health history, current medication. Who needs it? Primary Medicare Advantage plan members, though some traditional Medicare beneficiaries may also be encouraged to complete an HRA. usually conducted annually with an initial assessment within a specific time frame after enrolling into an MA plan. I do it whether it's a mid-year enrollment, whether it's during AEP, whether it's their T65, whether they're entering Medicare due to disability. At any time, I will do an HRA. The benefits is that it helps healthcare providers develop personalized care plans, which we already read, enables proactive management of chronic conditions, and may lead to preventative screenings or interventions based on identified risks. Charlie, do you have anything to add?
Is there something specific I'm supposed to add?
No, I'm just asking.
No, I don't really. Well, I will say this with HRAs, one of the things about an HRA that's beneficial to our clients is that if we filled it out for them and whenever it makes it to the carrier side, a lot of times they will go ahead and start setting up care coordination for that patient, and so it just kind of expedites the process a little bit, especially for those patients that have chronic illnesses and need that care coordination.
Exactly. So this was part one, and I want to discuss what's coming up in the future because we have worked extremely hard on this as a 4-part series. So in 2 weeks, on the 15th or the 22nd, we will be going over understanding the different plan types, such as HMO, PPO, special needs plans, comparing benefits, cost sharing, provider networks, and extra benefits. A lot of times you get calls from people and they're like, I saw on the TV that I could get free groceries. You know, you get these questions that happen all the time. So, yeah, that is what else we'll be discussing. And also using Medicare plan comparison tools effectively. I will be very brief on my part, but Charlie will dive into her tools. Anybody, anytime you have questions about tools, when you call me, all I'm going to do is tell you to call Charlie because I have no idea. I suck. I'm awful. I can write now, but that's about as far as you're going to get with me. So I hope that you all come back in 2 weeks. It is a 4-part series, and we're just going to dive deeper and deeper. By the time we end this, we did it a little light today because we know we are going to hurt your brain over the next several weeks. So definitely come back for more because you're just going to learn more and more and more. Alex, my brain appreciates the pain. Okay, so does anybody have specific questions about what we went through? Anything specific?
I have a couple.
Go for it.
When we're asking them, when we're doing the needs analysis and we're asking whether they have any surgeries coming up and we get an answer, what is it that we should be doing?
You need to go to that carrier's website. So if it's Humana, United Healthcare, whoever, you need to go and get in the agent portal and download their transition to care form. It needs to be specific to the carrier. We do that for people who have durable medical equipment a lot, especially oxygen, or if they have a surgery, or if they're in a treatment and now they're switching over to Medicare. Just because you want it to be a seamless process so that everybody, I mean, if they're on oxygen, they need it. If they're going through a treatment, we want them to be able to get it because we don't want them calling us angry or filing a complaint if they don't get what they feel like they need. So if you identify things that they're already doing or that they have a need, always fill out a transition to care form through the carrier and email it in.
Okay, so that if I identify it, so now I'm thinking, gosh, maybe I failed to identify it. So
they'll bring it up. They'll bring it up because when you're talking to them initially, I know that you're going to find out if they're on oxygen, right? Have you had anybody on oxygen yet?
Not that, no,
Oh, no.
no, I don't think so.
It comes up. Things like that, they are going to bring to your attention. It's not something, remember we went through the do's and don'ts ask, and there was a lot of don't ask about their health unless it's pertaining to the plan, like to identify if they need a chronic special needs plan. Just, you can ask. And when I ask, I just say, do you have any treatments or any procedures coming up that I need to be aware of? Because we'll need to fill out another form. But everybody who's been on oxygen that I've enrolled has said, I'm on oxygen and I use such and such, like Lincare or whoever. And not all carriers cover the same home health or durable medical equipment salespeople. So that is something that if they do have durable medical equipment that's delivered to their home, you'll want to find out who they use.
And they're usually very aware that it might not be covered, that sales company might not be covered under a new carrier. So they're going to say something like, just make sure that I can keep my oxygen or something like that. So they're pretty aware that it might not transfer over, that they may have to change companies. And so they're going to bring it up to you.
Okay. Second question regarding the HRAs. After going through the enrollment process in Sunfire, that's when you see that they're available.
Mm-hmm.
But the length of that appointment has sometimes already been 45 minutes to an hour.
Uh-huh.
So do you reschedule that, or do you just
No.
carry on?
I keep going.
It takes about 5 minutes to fill out. It's not really very lengthy. A lot of the questions they've already answered. They've already told you whether or not they have a heart issue, because you were talking about chronic illnesses. They've already identified whether or not they have a caregiver that has to take care of them. So you're getting some of the information that's on the HRA through just general conversation anyway. But I fill it out. But I do always make sure that I let them know that we are filling out a form that does not affect their application for their plan. It does not affect their ability to get on the plan that we've already talked about. It is not underwriting. It is just to help them out after the fact.
Okay, good. Good stuff. I enjoyed this. Thank you.
Yay! I will tell you in 2 weeks, it's going to be a lot more intense. Maybe I just feel that way, Charlie, because you're going over technology. I don't know.
Maybe. I don't know. We're doing a pretty deep dive here. I think no matter which session you attend, you're going to get some useful information.
Should attend all 4. You really
That's
should.
right.
Okay, guys. Well, thank you for attending. Bye.